Hi, this is my treatment plan presentation. We're doing this one for thoracic compression fractures. This is case number 7. All right, so just a quick introduction of the patient. The patient is a 65-year-old female referred to physical therapy for treatment of a thoracic compression fracture. So with that fracture, she's also been diagnosed with osteoporosis. So she does have weaker bones. So that's something to take into consideration for the rest of the treatment as well. How it started was about 2 weeks ago. She had a sudden onset of thoracic pain after twisting to reach for something. All right, so a couple of subjective findings right here for the patient. All right, so pain is worsened by sitting, standing, twisting, or bending forward. So she has typical symptom producing factors. So when it comes to twisting and bending forward, those are not what you want to do with a compression fracture because they cause more pain. Also, the patient can only tolerate sitting for approximately 20 minutes. So the longer she sits, the more she hurts. So that's something we have to factor in and hopefully improve as we go along. All right. In terms of objective findings, the patient presents with kyphotic posture and protracted scapulas. She's a 44 out of 56 on the Berg balance scale. So two of the big things we're going to be working on are going to be good posture and balance. All right, so a little bit of explanation behind what's going on. So compression fractures are pretty much collapsing of the middle section of the spine. They can be caused by either trauma or conditions like osteoporosis. They most typically occur in the lower portion of the thoracic spine. All right, so one of the things that I did as an intervention was longitudinal soft tissue for the paraspinals. So the patient was having muscle spasms of the paraspinals from T6 to T10 bilaterally. So I did longitudinal soft tissue because I needed to relieve that muscle tension to help with those spasms. I did this on my dad. So I'm just working along those fibers. So it's mainly the ones from T6 to T10. So didn't have to go all the way down to the sacral region or all the way up to the cervical region. So just trying to stay in those areas on both sides to help relieve some of that tension on the muscle. All right. So I also had to do patient education. In terms of this, I mainly focused on posture. The the main thing that was needed was educating the patient on keeping her neck straight, her shoulders back, and her back extended and straight. She presented with a kyphotic posture and also protracted scapulas. So she had really rounded shoulders, back wasn't straight, neck wasn't straight. So, in terms of having a compression fracture, the only way to alleviate those symptoms is to go back into extension, and keeping that posture helps alleviate those symptoms. So, not only is it good to have the good posture, but it also helps her in terms of alleviating pain. All right. Next up is the home exercises. The main one that I chose to present on the day was scap squeezes. So the objective finding that led me to choose this was the patient presenting with protracted scapulas. So she had rounded shoulders, which wasn't contributing well to her posture. It's causing more kyphosis. So we've got to strengthen those scapular retractors, which is why I chose scap squeezes. That being said, that would help with retracting those shoulders back and preventing that postural issue. So the main thing we want to focus on is getting our arms up here, elbows at a right angle, and pulling those shoulders back so that the scapula or shoulder blades squeeze together. The parameters I set were hold the squeeze for 10 seconds, do that 5 times, and repeat 3 times daily. The main thing to focus on is keeping that good posture so that we don't increase any of those symptoms for her compression fracture. All right, so last up, we have the prognosis for the patient. So, in terms of thoracic compression fractures, returning to normal function is possible, especially with conservative treatment within 8 to 10 weeks. That's the normal turnaround for these type of fractures. Sometimes, if the fracture is a little bit more serious and it requires surgery, it does change the prognosis up. Instead of taking 8 to 10 weeks, it usually takes several months to get back to where we need to be. So in terms of my patient today, in case number 7, she showed improvement for her posture, her balance, and her strength at the 4-week mark reevaluation. However, going forward, she still does need to continue to improve. So while normal function has been returned, she will need to consider having osteoporosis as time moves on with these fractures. So continuing to stress good posture and body mechanics will help her avoid more fractures and overall improve her symptoms if they do continue going forward. With her diagnosis of osteoporosis, she also has to continue taking the medication for that diagnosis. So as long as she continues her therapy and does her exercises at home, takes her medications, and continues to show good posture, prognosis for her is pretty good. She should be better within the 8 to 10 week mark. All right. Thanks for listening and hope you enjoyed it.